Welcome back. I know you're really interested in getting a better grasp on youth mental health services, specifically in Finland,
Yep.
and how those services compare to what adults can access over there.
Right.
And you've sent over some fascinating material. It seems like there might be some differences, right, in terms of how easy it is for young people versus adults to get the help they need.
Yeah, definitely some questions there.
So that's exactly what we're going to look at today.
Sounds good.
We really want to make sure you come away from this with a clear picture of the situation.
All right.
So we're going to take a deep dive into how Finland structures its mental health services, especially for those under 18.
All right.
We're going to try to pinpoint any roadblocks they might hit, and then look at what solutions are being put in place.
Okay.
And all of this is coming straight from the sources you provided. So to start off, I think it makes sense to get a baseline understanding of how the adult mental health system works in Finland.
Yeah, that's a good place to start. I mean, so for adults in Finland, the healthcare system, including mental health, is pretty decentralized.
Decentralized, okay.
Meaning that it's the well-being services counties that are mainly responsible for how these public services are organized and provided.
Okay.
And one thing that's really interesting is that back in the 1990s, mental health services were actually integrated into the broader healthcare system.
So it wasn't always a separate thing.
Exactly.
Interesting.
They decided to combine them. And I think the reasoning there was probably to try to fight that stigma around mental health and, make sure it was viewed as just as important as physical health.
Okay, so if I'm an adult in Finland and I realize I need some kind of mental health support, where do I even begin?
Well, you would usually start with outpatient services.
Okay.
The most common ones being health centers.
Okay.
And psychiatric outpatient clinics.
Okay, so those are kind of the first point of contact.
Exactly.
And how do those differ?
Health centers are often the place where people go when they have more, I guess you could say, common mental health concerns.
Got it.
And the staff there play a big role in figuring out if someone needs to be referred to a specialist for more specialized care.
Okay.
So they're kind of like a first step.
A gatekeeper in a sense.
Exactly, yeah.
So say I do need more specialized help, what happens then?
Well, usually you would get a referral.
Okay.
That could be from a doctor at a health center or sometimes from occupational health services if you're employed.
Okay.
The primary care physician basically takes a look at your situation, makes an assessment, and then if they think you need more specialized care, they'll refer you on, usually to a psychiatric polyclinic or a mental health center.
Okay.
Now, in some places, you might be able to make a direct appointment at a psychiatric polyclinic, but usually a referral is how it works.
Okay.
And these polyclinics, they're basically dedicated mental health centers.
Okay.
They handle more complex or severe cases more than those general outpatient clinics would.
Okay, so it sounds like there's a bit of a process there involving primary care as a gatekeeper, to guide you to the right place.
Exactly, yeah.
And what about options outside of this public system? I mean, are there private services or other organizations that provide support?
Oh, absolutely.
Okay.
Private mental health providers and a whole bunch of different third sector organizations, they play a big role too.
Got it.
Like there's this organization, Mieli Mental Health Finland. They offer things like hotlines and online support, even peer support groups.
Okay.
So they're doing some really vital work. And what's really interesting is that a lot of these third sector organizations, they actually get funding from, believe it or not, governmental gaming monopolies.
Oh, wow. That's really interesting.
Yeah. And then there's Kela, the Social Insurance Institution of Finland. They can provide financial help for psychotherapy, but you usually need a specialist to assess and say you need it.
Okay.
So there are some options there.
It sounds like there's a lot of moving parts to this system, different providers, different funding sources. I imagine that complexity itself might be a bit of a hurdle for someone trying to find help.
Oh, absolutely.
Right.
It can definitely be tough to navigate all those layers, the different levels of care, the different types of providers, especially if someone's facing an urgent situation or has really specific needs. And the whole system really hinges on those primary care professionals.
Right.
They have to be really well trained so they can direct people to the right specialized services.
Makes sense. And you mentioned decentralization. So does that mean there are some regional variations in how these services are provided?
Exactly. That definitely came up in the sources you shared.
Okay.
The quality of care, how available the services are, it can be quite different depending on which well-being services county you're in.
Okay, so someone in one region might have easier access to certain types of therapy than someone in another region.
Exactly, yeah.
Okay, well, that gives us a good overview of the adult system and some of the potential challenges there. Now let's zoom in on the services for those under 18. You mentioned a strong emphasis on early intervention. What does that look like in practice?
Well, the system for younger folks is really built around this idea of catching things early.
Okay.
Preventing things from escalating. And two key players here are the child welfare clinics and the school and student health services.
Okay, so those are on the front lines.
Right.
Got it.
And these services have nurses, psychologists, doctors all working together. They're really crucial for spotting potential mental health issues early on and then giving that initial support to these children and young people.
Okay. And I guess the school environment is a natural place to start since kids spend so much time there.
Right.
Makes sense.
So the schools are really key for noticing these issues early.
Okay, so say they do notice an issue, say a child or adolescent needs more specialized support.
Yeah.
What happens next?
Well, there are specific referral pathways set up. So from those initial points of contact in schools or child welfare clinics, they can refer kids to specialized youth psychiatric clinics for more intense treatment.
Okay.
And one thing that's really interesting here, and it might be a big difference from adult services in terms of how they prioritize things, is that Finnish law actually has specific time frames for dealing with mental health needs of anyone under 23.
Time frames written into law?
Yeah, exactly.
Tell me more about that.
So for this younger group, anyone under 23, the law says that they have to do treatment evaluations and specialist assessments within 6 weeks of getting a referral.
Wow, okay.
And then, if that assessment shows the young person needs specialized treatment, they have to start that treatment within 3 months of it being prescribed.
Okay.
So there's a real commitment to getting young people the help they need quickly.
Yeah, it definitely sounds that way on paper.
Right.
What other components are there to this system for those under 18?
Well, within the healthcare system, you have specific units, child and adolescent psychiatry units. And then on the municipal level, you have social services that can provide educational support and advice to families.
Got it.
And, of course, there are all sorts of government policies and initiatives and projects that are aimed at improving mental health services and promoting well-being among young people.
So at first glance, it seems like there are pretty solid structures in place, both for adults and for those under 18.
Yeah,
But the fact that we're here discussing potential disparities based on the sources you've reviewed suggests that the reality might be a bit different, right? Especially when it comes to actually getting timely and appropriate care.
yeah, that's exactly it. I mean, even though there are all these structures and these legal requirements for timely treatment for those under 23, the information you've provided, it points to some real challenges.
Yeah, okay.
Particularly when it comes to how long young people have to wait and just how easy it is for them to get the support they need.
Yeah, let's dive into those disparities a bit. The sources you looked at, they highlighted this problem of long waiting lists for adolescents trying to get mental health support.
Right.
How widespread does this seem to be?
It's pretty significant.
Okay.
Adolescents themselves have reported really long delays in trying to access mental health care.
Wow.
And it seems like the pandemic might have made things even worse.
Yeah.
You know, more mental health challenges among young people, more strain on services that were already stretched thin.
Right.
And what's really concerning is that even the primary care practitioners, the ones who are often making the referrals, they're the ones saying that these long waiting lists are a major barrier to giving young people the help they need.
So this is happening even though there's a legal requirement for evaluations within 6 weeks and treatment within 3 months for those under 23.
Yeah.
It sounds like there's a real disconnect between what the policy says and what's actually happening.
Exactly, yeah. I mean, all these reports of long waiting lists, they seem to indicate that the system just can't keep up with the demand for mental health services for young people.
Yeah.
And they're not meeting those legally mandated timeframes either. And that's a big problem because delays like that, they can really harm young people's well-being.
Right. It can make their conditions worse,
Exactly.
delay the help they need at a really critical point in their development.
Exactly.
Okay, so aside from those waiting times, what other systemic barriers are there? What else is making it tough for young people to get these services in Finland?
Well, from what I gathered from the sources, there are a few things that are all kind of intertwined.
Okay.
One is that there's a real lack of mental health services that are readily available, high quality, and maybe most importantly, developmentally appropriate, designed specifically for children and adolescents.
Okay.
And it seems like this is often because there just aren't enough resources being put towards youth mental health.
Right. Not enough funding.
Yeah.
Okay.
And there's also a shortage of mental health professionals who are specifically trained and experienced in working with this age group.
Right. So a workforce issue as well.
Yeah.
Okay.
And then on top of that, the quality and availability of those specialized services, they can vary a lot depending on where you are in Finland.
Okay.
And the adolescents themselves, they've said that often the number of therapy sessions they're offered just isn't enough to really address their needs.
Right. Like they need more than they're getting.
Exactly.
Okay.
And then there's the issue of finances.
Okay.
Primary care practitioners have said that financial constraints can limit their options when it comes to referrals.
Okay.
So it really seems like there's a concerning shortage of behavioral health care resources across the country.
Right.
And this seems to hit young people with psychiatric disorders especially hard.
So it's a workforce shortage, potential funding issues, and then these geographic inequalities.
Right.
Okay, so those are all challenges within the formal healthcare system. But what about factors outside of that? I mean, do social or cultural aspects in Finland play a role in all of
Oh,
this?
definitely. I mean,
Okay.
the social and cultural context can have a huge impact on whether young people even seek help in the first place
Right.
and whether they get the support they need, like the stigma around mental illness.
Okay.
Is still a big problem,
Yeah.
and some people have negative beliefs about mental health services themselves.
Right. So it's not just a stigma around the illness,
Yeah,
it's about the services too.
exactly.
Okay.
And then, adolescents might feel embarrassed or ashamed.
Right. They might not want to tell anyone.
Exactly.
Yeah. They might fear being judged by their peers or their family.
Yeah.
Okay.
And then there's this cultural emphasis in Finland on self-sufficiency, being stoic.
Right.
And that might unintentionally discourage young people from asking for help
Yeah.
because they might feel like they should be able to handle their problems on their own.
It's like they're supposed to just tough it out.
Exactly.
Yeah. That's really insightful.
Yeah.
And what about families? I mean, how do their attitudes and their involvement affect things?
Oh, that's huge.
Okay.
I mean, the attitudes and behaviors of loved ones, especially parents or guardians, they can make a huge difference.
Okay.
If a parent doesn't understand what their child is going through or doesn't support them, that could be a big obstacle to getting help.
Okay.
And sometimes parents might even have negative views about psychiatric treatment or medication.
Right. So that adds another layer of difficulty.
Yeah,
Yeah. Okay, well, it's clear that there are all these complex challenges and they're all interconnected.
right.
But the good news is that it seems like the Finnish government is taking youth mental health seriously.
Yeah.
The sources you reviewed, they talked about some national strategies and initiatives aimed at addressing these problems. Can you give us a quick overview of some of the key ones?
Sure. I mean, at the policy level, Finland has definitely shown a commitment to tackling this.
Okay.
There's this national mental health strategy and program for suicide prevention.
Okay.
It was launched in 2020, runs until 2030, and it very clearly identifies positive mental health in children and young people as one of its 5 key priorities.
Okay, so it's a long-term plan and young people are specifically mentioned.
Yeah, absolutely.
Okay.
And the strategy really stresses prevention and early intervention,
Okay.
and making sure mental health services are accessible to everyone, regardless of age.
Okay.
And it also recognizes that to really make progress, they need collaboration across different sectors.
Okay.
So social welfare, healthcare, education, they all need to be working together.
Right, it's a multi-pronged approach.
Yeah, exactly.
Okay.
And then there's the Finnish National Child Strategy, which came out in 2021.
Okay.
It also puts a big focus on promoting mental health and making sure there's effective treatment available for mental health issues in children and adolescents.
So these high-level documents really demonstrate that the government understands the importance of this, right?
Exactly, yeah.
Okay. Beyond these broad strategies, have there been any specific legal or policy changes lately aimed at improving youth mental health services?
Yeah, there have been some important developments.
Okay.
The government has actually proposed a maximum waiting time of just 1 month for primary mental health services.
Wow, just 1 month.
Yeah,
Okay.
specifically for those under 23.
Okay.
So the goal is to make sure young people can get help quickly and for free when they first reach out.
Okay.
And then there's also this updated legislation that came into effect in 2021.
Okay.
It basically says that those well-being services counties, they have to provide high-quality and easy-to-access mental health services.
Okay.
And it reinforces that existing 3-month time frame for starting treatment for those under 23.
Okay, so there's an emphasis on both speed and ease of access.
Exactly.
Okay. And it seems like there are a number of organizations and projects that are actively working to support youth mental health.
Oh, yeah, absolutely. I mean, Finland's got a long history of investing in mental health research and development.
Okay.
And there's this NGO, Milli Mental Health Finland. They're super active.
Okay.
They're involved in loads of projects that are specifically focused on promoting youth mental health and providing support services.
Okay.
And then there's the National Youth Work and Youth Policy Program. It covers the years 2024 to 2027.
Okay.
And their priority is providing mental health support for those aged 12 to 25.
Okay.
And they really emphasize a coordinated and multifaceted approach.
Right. Bringing different players together.
Right.
Okay.
And then there are initiatives like the Mental Health and Youth Work Project. That one's all about equipping youth workers to better understand mental health issues and give effective initial support. And then you have the Consensus Project, runs from 2021 to 2025. They're all about developing and putting into practice effective ways to promote well-being in primary schools in the Ostrobothnia region.
Okay, so there's a lot going on.
Yeah, there's definitely a sustained commitment to addressing youth mental health needs at all these different levels.
Okay, well, it's really helpful to get a sense of both the challenges and the efforts that are being made in Finland.
Right.
But let's broaden our perspective a bit. If we look beyond Finland, what can we learn from other countries?
Mm.
Are there any countries that have particularly effective youth mental health systems?
Yeah, absolutely. I mean, when you look at these models from around the world, there are some common threads,
Okay.
like a huge emphasis on early intervention and prevention.
Okay.
That's a consistent theme. And then they tend to prioritize models of care that are appropriate for the local context and are backed up by evidence.
Right, so it's not one size fits all.
Right.
Got it.
And it's really important to make sure that those services are integrated, equitable, and that there's good coordination between different providers and settings.
Okay, so everyone's working together.
Exactly. And they really try to make services youth-friendly and accessible.
Right, tailored to the needs of young people.
Exactly. And they take a holistic, person-centered approach.
Okay.
So they're not just looking at the mental health issue in isolation, but considering the individual's whole context.
Right, their broader needs.
Exactly.
Okay.
And these systems usually offer a bunch of different interventions that can be adapted to different levels of need, and they really involve families in the treatment process.
So it's not just about the individual, it's about their support system as well.
Yeah.
Okay.
And they make sure there's a comprehensive continuum of care that addresses everything from mild to severe needs.
Okay.
And along with all that, there are community-wide awareness efforts aimed at reducing stigma. And increasingly, there's this recognition that it's really important to involve young people and their peers in designing and delivering these services.
Right, so they have a voice in the process.
Exactly.
Okay.
And a lot of these effective systems, they have really strong school mental health programs.
Okay.
And they take a multi-sectoral approach, so health, education, social services, they're all involved.
Okay.
And there are some specific integrated care models, like the collaborative care model and the primary care behavioral health model.
Okay.
They're good examples of how to embed mental health support within primary care settings.
So they're bringing mental health care into those familiar settings where people are already going.
Exactly.
Okay. Are there any particularly innovative approaches that stand out from these examples?
Yeah, I mean, a few things really jump out. One is the importance of having strong community-based mental health care networks.
Okay.
That way, you're not just relying on these highly specialized centers for routine care.
Right, so making it more accessible in the community.
Exactly. And then there's the use of technology,
Okay.
digital platforms. They can really help to expand reach and give people more flexible support options.
Right, especially for young people who are very tech savvy.
Exactly.
Okay.
And then there's mental health screening in schools and primary care
Okay.
that can help catch issues early on.
Right, identifying problems before they escalate.
Yeah.
Okay.
And investing in crisis prevention and response services is key
Okay.
so that people have somewhere to turn when they're in a crisis.
Right, immediate support when they need it.
Yeah, and then making sure that caregivers and educators, they're trained and supported to recognize and respond to mental health needs.
Okay.
That's really important.
Right, equipping them with the tools and knowledge.
Yeah, and then a big one, making sure that young people and their families, they actually have a say in how these services are developed and evaluated.
Okay.
Because ultimately, they're the ones who are using them.
Right, their voices need to be heard.
Exactly.
Well, that's a lot to think about. And based on what we've learned about Finland, the challenges they face, and these international best practices, what potential solutions are there? What concrete steps can be taken to improve access for young people in Finland?
Well, there are definitely some important areas to focus on. One is funding and resource allocation.
Okay.
It might make sense to think about increasing overall investment in youth mental health services.
Right, putting more money where it's needed.
Yeah, exactly.
Okay.
And specifically addressing that shortage of behavioral health resources, especially those that specialize in child and adolescent care.
Okay.
It might also be a good idea to strategically reallocate some existing funds
Okay.
to prioritize community-based services and early intervention programs.
Okay.
And maybe there are some innovative funding approaches they could explore, maybe partnerships with the private sector or philanthropic organizations,
Okay.
and making sure that integrated youth services have sustainable funding.
Right, so not just a one-time investment, but ongoing support.
Yeah, exactly.
Okay, so making sure the money's there and that it's being used strategically. You also mentioned the staffing shortages earlier. How can those be addressed?
Yeah, I mean, that's a critical area for improvement.
Okay.
They need to invest in strategies to increase the number of qualified child and adolescent mental health professionals.
Right, so training where people.
Right. And
Okay.
it's not just about quantity, it's about quality too.
Okay.
They need to enhance the training for primary care physicians and school personnel so they're better equipped to spot those early signs of mental health issues in young people.
Right, so giving them the skills and the knowledge to recognize those problems.
Exactly.
Okay.
And they need to know how to respond appropriately, how to make those referrals.
Right, so they're not just identifying the problem, but they know what to do next.
Exactly.
Okay.
And this training should really focus on communication skill too, so that they can communicate effectively with adolescents.
Right, because that's a different skill set.
Yeah, and they need to understand the unique needs of young people who are going through that developmental stage.
Right, it's not just treating them like mini adults.
Exactly.
Okay, so investing in the workforce, both in terms of quantity and quality. You also mentioned the potential of integrated care models.
Right.
Those examples from other countries. How can those be applied in Finland?
Yeah, I think that's a really promising avenue.
Okay.
Those models that combine mental and physical health services within primary care,
Okay.
that could be a really good way to improve early identification, make services more accessible, and make sure that young people are getting coordinated care.
Okay.
And there's some specific models that could be adapted to the Finnish context,
Okay.
like the collaborative care model and the primary care behavioral health model.
Okay.
And then there's the Care Nova model that one focuses on integrating staff from schools and the community.
Okay.
So it's all about creating a seamless system of support.
Okay, so kind of breaking down those silos between different services?
Exactly.
Okay. And of course, there will always be a need for those specialized child and adolescent mental health centers
Right.
for those who need more intensive treatment. But it sounds like the key is making sure they're accessible,
Exactly.
right? Geographically accessible, financially manageable,
Yeah,
and well integrated into that broader continuum of care.
exactly.
Okay, so it's not just about having those specialized centers, it's about making sure they're part of a bigger system.
Right.
Okay. And what about technology? I mean, digital health solutions seem like they could play a big role here.
Yeah, definitely. I mean, Finland is already really advanced when it comes to technology.
Right.
So they're in a good position to leverage that,
Okay.
like expanding telemental health services.
Okay.
That could be a great way to reach young people in rural areas, those who might have trouble getting transportation, or those who just feel more comfortable getting support remotely.
Right. So removing some of those barriers.
Exactly.
Okay.
And they could develop some online resources and platforms that are specifically designed for young people.
Okay.
Things that offer reliable information, self-help tools, and ways to connect with support.
Right. Meeting them where they are online.
Exactly. And those digital platforms, they can also be used for early identification and screening.
Okay.
And there's potential for using evidence-based e-health interventions as part of routine clinical practice.
So technology can play a role at all stages, from prevention to treatment.
Yeah, definitely.
Okay, well, let's wrap up by focusing on those who are interacting with young people on a daily basis.
Okay.
The schools, the primary care physicians, and the community organizations. How can they be better equipped to support youth mental health in Finland?
Well, for schools, one of the most important things is to make sure that school staff know how to spot those early warning signs,
Okay.
and then to implement comprehensive school mental health programs.
Okay.
So they're not just relying on individual teachers noticing things.
Right. There's a systematic approach.
Exactly.
Okay.
And it's really important to make sure there's good collaboration between school staff and outside mental health professionals.
Right. So they're not working in isolation.
Exactly.
Okay.
And there are some good models out there, like the Let's Talk About Children approach. That one focuses on improving communication between parents and teachers.
Okay. So everyone's on the same page.
Yeah.
Okay.
And then addressing things like bullying and promoting a positive school climate.
Right. So it's not just about addressing mental health issues directly, but also creating a supportive environment.
Exactly. And then for primary care physicians, it's really important to enhance their training in child and adolescent mental health.
Okay.
Make sure they have access to resources
Okay.
and that the referral pathways to specialized services are clear.
Right. So they know exactly what to do.
Yeah.
Okay.
And it might be helpful to bring in other mental health professionals like counselors or therapists to work as part of those primary care teams.
Okay. So expanding the expertise within those settings.
Exactly.
Okay. And it's important to recognize that primary care is under a lot of strain right now,
Right.
with the rising demand.
Yeah.
So they need adequate support to handle that.
Exactly.
Okay.